So the topic of today's video is health, guys, and it's pretty apt because I've been a little unwell the last week or so with the flu, as you can probably tell. Health in Vietnam, what does it mean? What's it like? What's the healthcare system like? So let's have a wander around the park and let me discuss it with you. So when it came to COVID, Vietnam did a great job. One of the best jobs in the world, I believe. But there was a price to pay, and that price was doctors quitting. And I know this firsthand because I've got some friends who are doctors and nurses, healthcare professionals here, and they really had a hard time over COVID. They had to stay in the hospitals. They didn't get any time off. They were exhausted. So by the end of it all, a lot of them quit. A lot of them couldn't quit because they just started on their careers and they needed to get experience. But the older ones, for sure, a lot of them threw in the towel and moved on to something else. So there's two distinct types of hospitals here: public hospital and private hospital. So public hospital is government run, and it can be further split down into 4 different types of hospital: district, commune, etc., etc. The public hospitals are super crowded, so if you are Vietnamese, this is probably your first point of call. Government hospitals here are very busy, very noisy, but they get the job done. And I'll stand by what I always say. It's one of the things I love about Vietnam, is being able to walk in off the street and to get reasonable healthcare in many of the hospitals and clinics that are around. So if you are a taxpayer here, you get social insurance, and that will cover you for basic healthcare needs. I've got this myself because I'm a temporary resident here, but I've tried to use it and I couldn't, because my Vietnamese is not good enough to navigate the paperwork and the things that you need to do to use it. So I use a private hospital or private hospitals when I need to go and use the services of a doctor. I get this through health insurance, which you pay for monthly. So many jobs will give you health insurance as part of the package when you come to Vietnam. And if you're coming here for a long time, perhaps as a digital nomad or to retire, then you're probably going to have to pay for that yourself. So what are the costs of private healthcare in Vietnam? Well, it depends on many factors, like it does all over the world, and you're going to be paying upwards of $150 a month to anywhere over $1,000 a month if you've got pre-existing conditions and you're over 50, because they're going to put you in the high risk category. What are some of the health problems that Vietnam faces, and what are some of the health issues here? Well, dengue fever is a big one at the moment, especially in the south during rainy season. Dengue fever is caused by a virus transmitted by a mosquito. So the mosquito is the vector. They transmit the virus, and it's not always fatal. It can be fatal depending on you, but about 70% of people or so don't actually get any symptoms from dengue, but the ones who do get pretty severe flu-like symptoms, and this can lead to all sorts of further complications. So if you do get bitten by a mosquito, a couple of days later you get terrible headaches, really bad aching, like flu-like symptoms, you probably should go and see a doctor, because it could be dengue fever. What other kind of diseases do we see here in Vietnam? Well, tuberculosis is still quite prevalent. I think Vietnam is around 13th in the world in regards to prevalence of TB. And one of the problems with that is drug resistance. So to treat tuberculosis, you typically need a long course of antibiotics, and these are often not finished. So this leads to antimicrobial resistance, AMR, which is a huge problem all over Southeast Asia. When we talk about pharmacies, guys, which I'm going to talk about next, I'll tell you why this is an issue. So what's the leading cause of death in Vietnam? Well, I believe it's things like heart disease, lung cancer, similar to many other countries in the world, or most other countries really. A lot of these are preventable diseases though. So Vietnam has a huge rate of smoking and drinking. People who smoke and drink, I think over 20% of people over 18 smoke, probably a lot more of them drink, and of course not good for your health. Cigarettes, very cheap in Vietnam, as is alcohol, so it's very tempting for some people to smoke and drink perhaps a little bit more often than they should. What's wrong with it? What's the problem? Why? Tại sao?
No.
Why? Tại sao? I'm just relaxing. I'm just relaxing in the park. What's the problem? There's nobody here, look. So I can't ride my bicycle in the park. How ridiculous. There we are, folks. I've had to come a little bit closer to home. I was kicked out of Sala. I don't quite fully understand why. Maybe you can, people who are better at Vietnamese than me can perhaps understand what the guard was saying in the comments. He didn't like my bike. I don't know why. I was just sat in the park, minding my own business in the afternoon. Nobody around, and yeah, a couple of people come over and started to wheel my bike away. I really didn't like it, so very strange. First time that's happened to me in Vietnam. A little bit unfortunate, but there we go. Maybe he didn't like my bike. Maybe it was too big. I have no idea. So pharmacies really are everywhere in Vietnam, and Pharma City, as you can see, this one here is one of the most popular chains that you'll find right throughout the country. It's a real business thing, pharmaceuticals in Vietnam. I'm not sure how easy it is to become a pharmacist, but judging by the number of pharmacies I see, maybe it's not that difficult. So what about medications? What kind of medications can you buy in Vietnam? What's available? What can you buy over the counter, OTC? What are prescription only? Well, again, like a lot of the region, you don't really need a prescription for much. You don't need a prescription for too many items actually in Vietnam, but they are getting more kind of strict on requiring prescriptions. If you were to go into the pharmacy off the street and ask for antibiotics, chains like Pharma City now and Lom Chow, they're probably gonna ask you for a prescription. But traditionally they would just sell you anything here, which is both good and bad. I mean, in regards to antibiotics, it's a real problem because of AMR, antimicrobial resistance. So you get a lot of antibiotic resistant bacteria, not just in Vietnam, but Thailand and Cambodia as well. And that causes some real issues, not just locally, but for the whole world, because people pick up diseases when they're on a holiday and they get home and then they can't treat that disease because the bacteria causing that disease is resistant to the antibiotics that are available. So it's a big issue, guys. It's slowly, I mean, awareness is pretty good, but it comes down to money, and people, you know, if you go in somewhere with money, then they're probably going to sell it to you. If you're coming to live in Vietnam and you've got kind of chronic disease like arthritis, diabetes, for example, high blood pressure, then these types of chronic conditions very cheaply and easily managed here. So diabetes medication, things like metformin, insulin, very cheap here, very easy to buy. You certainly won't need a prescription to pick up those type of meds. Same for NSAIDs, painkillers, well, mild painkillers, very easy to buy, well stocked in most pharmacies. Same goes for blood pressure medication, hypotension, whichever one you may have. Very easy to buy medication for that here. And again, heart disease, beta blockers, statins, these sort of drugs are very easily available in their generic form and very cheap to buy as well. Just a couple of dollars a box for say 30 tablets of a statin. One thing that you do see here is a huge difference between generic prices and brand priced medication. So for example, AstraZeneca or Pfizer medication, you may pay like $35-40 for 30 tablets here, or you may pay $2 for a local Vietnamese produced or Indian produced pharmaceutical medication. So there's a massive discrepancy between brand name and generic medication. It's interesting because most doctors here, they don't like to use generics. They like to prescribe brands. There's a real faith in brands here, and it's kind of the opposite to the UK, where most doctors will shy away from brands because of the cost and prescribe you a generic instead. So to summarize, medications, pharmacies, easy and accessible to get medication here, especially for chronic common conditions such as diabetes and high blood pressure. Very simple and easy to, and cheap as well, to get medication to address these issues here. What about things like more complicated medical conditions that may require surgery or inpatient stays? Well, the doctors in the public hospitals are more experienced generally, in my opinion, because they just see a much higher caseload of patients. You know, I read there's only 8 doctors per 10,000 people in Vietnam. So the ratio of doctors to patients is really, really low. So that means they get to see a lot of patients and tend to have a lot of experience. However, equipment-wise, they're not going to have, you know, the most latest equipment, the robotic surgery tools, things like that. I mean, they may do, I don't know, but I don't think they would have that in most hospitals. And you do find people, and you hear about people going to, you know, Singapore, Thailand and Malaysia for more complex cases. But of course you're going to pay a lot more in those countries, probably more than you'd pay in the UK or Germany for surgery. If you get good medical insurance, there's companies here like Tenzing Pacific, AIA, Chubb, they all provide international insurance packages that cover inpatient and outpatient procedures. Outpatient just means day-to-day visiting, checks, medication. Inpatient would be things like surgery when you're actually inside the hospital. Once you include outpatient cover onto your insurance here, then it gets pretty expensive, and you're talking hundreds of dollars a month, because people tend to use it. So if they have outpatient cover, they're going to use it to get their medication, they're going to use it for any kind of health problems they have. And one of the things that's a bit different here compared to the UK, for example, is at home I would make an appointment to see my GP, my general practitioner, general doctor. Then he would then refer me to a hospital specialist who I'd see a couple of months later, who was a specialist in that disease. But in Vietnam, you're able to go straight to the hospital. Like, I can walk into the hospital now and see a specialist almost straight away. So it kind of cuts out the initial general or GP stage, which you have in a lot of Western countries. And I really like that, actually. I like that I'm able to go in and to speak to people and do tests straight away. And that brings me on to another point which I do really like here about the healthcare system, is the accessibility of testing. So things like blood tests and scans, very, very, very easy to get and very, very, very cheap, guys. I'm very easily able to walk into a hospital and pay maybe $20. For that $20 I'll get 8 or 9 blood tests. I'll give my phone number, my details, then within about an hour I'll get a text message telling me to go to their website, and my blood panels will be ready, and I can see myself if there's any issues, or I can then take those results to any doctor I like, not Dr. Google. And the same goes for scans, simple scans like x-rays, ultrasound, MRI. X-ray costs about $5, ultrasound $8 to $10 perhaps, MRI a little bit more expensive, maybe $40 depending on where you go. As you go into the private hospitals, then you're talking upwards of $80 to $100, but I believe compared to Europe and US, $100 for an MRI scan is still very, very cheap. As I mentioned earlier, Vietnam does face a bit of a ticking time bomb in regards to preventable diseases. So things like obesity, you know, is very, very low here, about 2.2% I think at the moment, lowest country in the world for obesity, but it's creeping up, and along with obesity comes things like diabetes, heart disease, high blood pressure, etc., all those types of things. And yeah, I hope the future will be healthy for Vietnam. Vietnam has one of the highest rates of alcohol consumption in the world, higher than Japan, India, China. Yeah, I think it's around 4 billion litres a year of beer. That's just beer that gets drank in Vietnam. Yeah, the locals here like to party. But of course, if you're drinking a lot like that, you're storing up all kinds of physical and also mental health issues potentially for the future. So what about mental health issues, guys? Things like anxiety, depression, how are these treated in Vietnam? Well, it's not something I'm particularly up on and aware of. I mean, there are hospitals that specialize in mental health and mental illnesses here. I do know someone who did take medication when they came to Vietnam. They were a teacher, actually. They told me they found it difficult to refill their prescription here for antidepressants. I don't know if that's the same across the country, but I think what you would probably find is that medication would be available as a brand medication, something like Pfizer, for example, and generics may not be available, so it could be seriously expensive. Obviously worth checking out before you come to Vietnam. If you take any regular medications and you're thinking of residing here for a long time, check out, you can always message me, the guys, and I can find out for you as well, but check out what is available, what's not available, but most things are available. One of the things that's not readily available here at all is strong painkillers. So If you are somebody who has, for example, let me think, chronic back pain, or you're in a lot of pain all the time, sciatica, you know, things like that, or you're recovering from surgery, or you've got long-term complications and you do need to take regular strong painkillers, they're just not available here. So anything opioid based, synthetic opioid based, morphine based is just not available, and even in hospital they're not available. I had an accident here years ago and I was in a lot of pain, and I was given basically paracetamol. I couldn't believe it, and I was in a lot of pain, and they were like, no, you can't have any morphine, you will be addicted. I said, I won't be. I need it. But yeah, and from that day I found out, actually, yeah, they're very, very strict on anything opioid based here. So if you are used to taking those types of medication, or you need to regularly take those types of medication, then you're going to be out of luck in Vietnam. And it's something to bear in mind, guys. It really is not available here. So there we have it, folks. Just a quick overview for you today of the healthcare system in Vietnam, what types of hospitals are available, government, private, how you can access them, the importance of insurance, pharmacies, what you can buy, what you cannot buy, and just touching upon some of the common tropical diseases, dengue fever, tuberculosis, not a tropical disease but fairly common in Vietnam. So just touching on those for you as well today, guys, so you're aware of what is in Vietnam and what's around. So there we go. I'm just going to take a walk by the river. So thanks for joining today, guys. I hope the information's been useful. Please think about subscribing to my channel if you haven't already. Plenty more cool updates to come from Vietnam. Have a great day. Catch you later.